Sending a patient back there knowing they're COVID positive is a big mistake.
14 presumptive cases of coronavirus in Louisiana.
It was bizarre that the Rolls Royce of nursing homes was not going to test everybody.
It's a high level of concern right now.
So you're basically sending Typhoid Mary to the nursing home to infect
The
other
number of
people.
nursing home clusters of coronavirus in Louisiana has risen today.
I don't know what to think. I don't know what to trust. This is terrible.
I'm extremely upset.
If he is infected, we might not see him again.
This is a cluster that is extremely concerning.
People all had to die.
No, I don't think so.
If anything, we have underreported COVID deaths in Jefferson Parish. I do believe the nursing homes were victims.
Limit exposure to the most
Cannot
vulnerable.
even lay their loved ones to rest.
We have some nursing
76
homes.
cases.
Really is just looking for the money.
It's a very large number, and it's concerning because, number one, we know how quick the virus can spread.
Where the nursing home residents have died has been a secret since late March, when the health department stopped naming the facilities. Using death records from Orleans, Jefferson, and St. Tammany parishes, we uncovered 16 homes where more than 5 people have died of COVID-19. You can see them on this map. The larger the circle, the greater the death toll. 21 residents have died at Lambeth House, home to the first cluster of cases identified in the state. St. Tammany death records show the virus took 21 residents at Forest Manor Nursing Home in Covington. 18 others died at Greenbrier Nursing Home in Slidell. In St. Tammany Parish, we found more than half of the COVID deaths were nursing home residents. The numbers are staggering, but not entirely surprising.
It's a group of people with either advanced age or advanced medical conditions who are living in relatively close quarters with people with caregivers who are going from patient to patient.
Records show in Jefferson Parish, 10 residents of Jefferson Health Center have died of COVID, 14 at Metairie Healthcare Center, 12 at Joellen Smith on the West Bank. And remember this?
I don't know what to think. I don't know what to trust. I don't know. This is terrible.
The day news broke of a cluster of cases at St. Joseph's in Harahan, family members wept, scared a case of COVID might be a death sentence for their loved one. Records reveal the virus has killed 8 people there.
Do you think some cases were slipping through the cracks early on?
Earlier, look, I'm glad you asked that, because if anything, we have underreported COVID deaths in Jefferson Parish. There's no question. We try to report every case accurately, but I'm sure there have been some deaths, especially early on when the CDC was not allowing us to mark a death as COVID without a positive COVID test.
The testing, experts say, it was the Achilles heel for putting the brakes on the pandemic. The inability for weeks to test those with suspected cases who had not traveled out of the country, the lag time in getting results, and it was agony for people like John Gathright.
It was March 16th when they called me to say, your mom's got fever and she's got labored breathing and coughing and, And that's when I said, are we going to test her for this coronavirus? And they said, no, at this point, I don't think we will.
He pushed them and got her a test. It took 4 days for him to hear the dreaded news.
She was, in fact, positive. At that point, your mind thinks it's a death sentence.
He started a largely unsuccessful crusade to test everyone in the facility, to get everyone tested in nursing homes to figure out who has it, since so many spreaders are asymptomatic.
I never could get my head around why they didn't want to. They said that the CDC had not recommended testing for everyone at the Lambeth House. So they were going with that recommendation.
The challenge is that it tells you information about what happens or what the state of play is at that point in time. It doesn't tell you who's going to be positive tomorrow. It doesn't tell you who's going to be positive the next day. And so it actually becomes very challenging to make decisions based on that. That's one of the things that the CDC has pointed out as they're working through what these recommendations might be in the future.
I connect dots.
Dr. William LaCourte is a geriatric physician who's the medical director for several New Orleans area nursing homes. He says in early March, area hospitals hesitated to take nursing home patients suspected of having the virus.
I remember one discussion I had with an ER doc. She said, don't admit this patient, he has COVID, send back to the nursing home.
Because of their age and their existing health conditions, LaCourte and other nursing home administrators who asked not to be identified said hospitals pushed the patients toward hospice care back at the nursing homes, fearing projections that they were about to be overwhelmed by a surge of COVID patients in need of ventilators, then in short supply.
So you're basically sending Typhoid Mary to the nursing home to infect other people.
LaCourte says he thinks nursing homes are the victims, but could the nursing homes have done more to stop the spread? In examining federal documents called Medicare Infection Control Surveys, we found some red flags about some of the homes hit hardest by the virus. Of those 16 homes hit the hardest, half were given F ratings by federal inspectors for infection control, 3 of them for repeat deficiencies. Just last week, residents gathered together on the balconies at Maison Orleans Nursing Home on General Taylor Uptown. Federal inspectors cited the facility in 2017 and again last November. Among other things, this inspection report found 2 nurses' aides did not properly dispose of their gloves or wash their hands after dealing with a contagious patient. All of the problems in the infection control citations we found were eventually corrected. But inspectors did note repeat problems in half of the homes cited.
It's a devastating time for humanity, but it's a devastating time, especially for the elderly population.
Howard Rogers is the head of the New Orleans Council on Aging. He says in the decades he's spent working with seniors, it's clear not all nursing homes are created equal.
We have a lot of excellent nursing homes in this state who follow the guidelines, who have adequate staffing, and who are able to take care of their clients. But then we have some nursing homes who really is just looking for the money. They're not really looking at what's happening with the clients themselves.
They're places where Rogers says people can be forgotten, spending out their remaining years alone. And even if they're not, if family members want to visit or check on them right now, the coronavirus adds another layer of cruelty. They can't. Whether it was the testing, the handling of COVID-positive patients in the earliest days of the epidemic, or infection control problems, at least 784 long-term residents have died, and there's a war on now to improve this country's standard of care.